Officials are working to clear up confusion about the COVID-19 vaccine. A CDC panel made two decisions last week about that vaccine: to not recommend it officially and to not require a prescription to get the shot. KCRG TV9's Emily Schrod joins us in the studio. And Emily, people have a lot of questions because the advice seems to be shifting.
Johnson County Public Health says the bottom line is it's still recommending people be vaccinated against COVID-19. Sam Jarvis with Johnson County Public Health says there's one big takeaway from the CDC's meeting last week.
Ourselves and so many others will be taking the information that we saw Thursday and Friday and making sure that it's clear as possible, and that we're still recommending folks to be vaccinated for COVID-19.
The CDC panel says people should decide for themselves if they want the COVID shot, but people won't need a prescription to do so.
It's really asking and looking for a conversation so that both the provider describes what risk the patient might have due to their health history, and that the patient's getting that information.
But Angelique Andrews, Chief Medical Officer at the Eastern Iowa Health Center, says having to connect with your care provider could be a hurdle for some patients.
That just poses difficulty in access because getting an appointment to your primary care provider can take several weeks.
But again, since no prescription is required, it's up to each person to get the vaccine or not. Jarvis adds he wishes the CDC had made a more formal recommendation for the COVID vaccine like it had done in years past.
I think most public health professionals and most folks across the medical space would have rather have seen a broad universal recommendation, much like we've seen in the past. But certainly this is a far better outcome than having it be prescription-based.
Working to
remove or limit as many barriers to vaccination as much as possible
for those who want it. A national trade association called America's Health Insurance Plan says companies will cover COVID vaccines through the end of 2026. Now Jarvis says he hopes to see those providers continue to do so after the end of that year. In the studio, Emily Schrod, KCRG TV9 News.
Emily.